Started. Good morning. My name is Jan Mold. I'm one of the assistant directors for HOSA competitive events, and I'm going to be talking about the cardiovascular system today, both anatomy and pathophysiology. So I wanted to start with a basic review that will really help you as we go through the different parts of the cardiovascular system. There are 4 chambers in the heart itself, a right and left atrium and a right and left ventricle. The atriums sit on top, and they are the receiving chambers. The bottom 2 chambers are the ventricles, and they pump. The right side of the heart always has deoxygenated blood in it. The left side of the heart has oxygenated blood. You also have valves that lead out of every chamber, and blood never leaves a chamber without going through the valve. Those valves are to prevent backflow. We want oxygenated blood going to the body and deoxygenated blood going to the lungs to get oxygenated. Arteries carry blood away from the heart, and veins carry blood to the heart. I can remember when I was in nursing school and trying to learn the flow of blood through the heart, I think I made it a lot more complicated at that time than it actually is. Blood comes to the heart deoxygenated through the superior inferior vena cava. Superior meaning above, inferior meaning below. And those are both vessels, they are veins. And remember, veins carry blood to the heart, and it is deoxygenated. That's why it's indicated in blue. It comes into the right receiving chamber or the right atrium. If it's leaving a chamber, you'll remember that it leaves through a valve. And this particular valve on the right side is the tricuspid valve. And you know tri means 3. So if you looked at this valve, you would see the 3 flaps. It goes down to the right ventricle, the pumping chamber. It's going to exit through a valve, and that is the pulmonary semilunar valve. Lunar meaning moon, semi meaning half, so it is half moon shaped. It's carried away from the heart through the pulmonary artery. From the pulmonary artery, it goes to the lungs where oxygenation occurs. It's carried back to the heart through the pulmonary vein, the one exception of a vein that carries oxygenated blood. It goes to the left side of the heart. Remember, left side always is oxygenated, to the receiving chamber, the left atrium. If it's leaving a chamber, it goes through a valve. In this particular valve, you may hear it referred to as the bicuspid valve, which means 2 flaps, or the mitral valve. To the left ventricle, the pumping chamber, through the aortic semilunar valve, the aorta being the largest artery in the body. So it enters the aorta and is carried throughout the body for oxygenation. So really not as difficult as I made it. When you break it down, it basically repeats on each side. I have a short video clip for you.
Throughout the body, carrying oxygen and nutrients to every cell. It's this circulation of blood that is vital to sustaining life. The heart is an organ made up of several tough layers of muscle. The pericardium is the thin layer that covers the exterior, while the endocardium lines the inside walls. The heart is divided into 4 chambers, 2 upper and 2 lower. The upper chambers, known as the atrium, receive blood coming into the heart. The lower chambers are the ventricles that pump blood out. Between each chamber are valves that open and close and help keep the blood moving. They are the tricuspid, mitral, pulmonary, and aortic valves. A pumping cycle starts when oxygen-depleted blood returns to the heart after circulating throughout the body. The blood enters through the right atrium before flowing to the right ventricle. It's then pumped to the lungs via the pulmonary arteries. There, blood is rejuvenated by air that's breathed in. The oxygen-rich blood returns to the heart through the left atrium, where it goes to the left ventricle. Then, by way of the aorta artery, the fresh blood is pumped throughout the body before the process repeats itself. That process happens with every heartbeat, and it's relentless. The heart beats 100,000 times a day, 40 million times a year, and up to 3 billion times over an average lifespan. But there are conditions that can disrupt a heartbeat and that normality. They can range from myocardial infarction or a heart attack to heart disease and hypertension. In contrast, exercise and emotional excitement can also have an impact on a person's heartbeat. The various blood vessels that comprise the circulatory system are a network of veins, arteries, and capillaries that span over 60,000 miles throughout the body, and the heart is the pump at the center of it.
Okay, so just a review then of the cardiac that we had gone over. So let's talk about some of those pathological conditions that were mentioned at the end of the video. And I'm going to cover two, which I think may be something that if you go into a clinical experience that you'll see. And the first is the myocardial infarction. Blood is supplied to the heart muscle itself through the cardiac arteries. Blockage of the blood flow to the heart itself is what a myocardial infarction is. And if you look at the picture here, you'll see that this part of the heart did not receive oxygenated blood, and that is called ischemia, and it results in tissue death. So when you hear somebody talk about how bad a heart attack was, they're talking about how much ischemic tissue is after the heart attack. Heart attacks can happen anytime, anywhere, and I want to share a brief part of this video with you that is an actual case. So we basically have a case where somebody's came to work, they're not feeling well. Get my video to play will be good.
Hey, Des. What is the no. You're going for 21-year-old male and 40 foot, 40 foot, over. Yeah, Roger, I received 5 foot fall, 21-year-old, 237-816, over. But no problems, we're on his way, Joe.
Cheers, love. Bye.
You know anything on the last one of diabetes, epilepsy? ECG looks a little bit dodgy at the moment, not 100% sure what it is, okay, but we'll just err on the side of caution. Just going to mean a trip down to LGI. Okay, let's pop that up there for us. Just pop it these two on your finger. Just pop another one.
God, I want water.
Yeah, we'll try one.
It's going to need to be the secondary site.
What time do they open?
8 o'clock. Or we're best with a crew.
I'll have a crew.
Yeah.
Please, mate. Okay. Alright, mate. Get down on the floor. In the game on the floor. Down here, mate.
Yeah,
Because they were employees with this particular patient and he was in the right place at the right time, he did survive. But heart attacks can happen anytime, anywhere. There are a wide range of symptoms, and I was taught when I was in school that it was classic, patients should come in complaining of an elephant sitting on their chest. Now, I don't know about you, but every elephant that I've ever seen, if it were sitting on your chest, it'd be excruciating. But as they've moved on, there's a lot of other symptoms, and it may not be classical. The patient may come in with sweating, shortness of breath, a rapid, weak, or irregular pulse, feeling sick, nauseated, or vomiting. Their complexion may be gray. The pain can spread to the jaw, neck, arms, back, and stomach, and it may be that they only have pain in their neck. Or they may come in with that persistent vice-like pain that was described as classical. I think it's really important to know that there are differences between how men and women present. Men may have those more classical symptoms of the crushing chest pain, the pain radiating down the left arm. Women may come in and say things like, I just don't feel right. I've been really tired. I feel like I have the flu. I feel like I have indigestion. And it may have gone on for a number of days. So it's really important we recognize that. Because treatment is important. We just saw the video sample of the guy who got instant treatment. There is what's called in treatment of an MI or myocardial infarction, the golden hour. It's known that the faster the treatment, the less damage to the heart muscle itself. So when you're talking about that golden hour, you're talking about when somebody steps through the door of the emergency room and the threshold, having them in the cath lab within 1 hour gives them the best possible outcome with a heart attack. And I know you've heard about a cardiac cath, but I just want to share this video with you so that you'll know a little bit more about what's going to go on when the patient has it. This is an educational video that is provided by one of the facilities.
EDSvideo.com. Thank you.
Hello, my name is Dr. Carlo Ojed. I am an emergency medicine physician, and in this video we're going to talk about cardiac catheterization. Your doctor has recommended that you undergo a cardiac catheterization. The most common reason to do this is to evaluate the cause of chest pain. Chest pain might be a symptom of coronary artery disease, and a cardiac catheterization can show whether a plaque is narrowing or blocking your coronary arteries. During angioplasty, a catheter with a balloon in its tip is threaded to the blood coronary artery. Once in place, the balloon can be inflated, pushing the plaque against the artery wall. This creates a wider path for blood to flow to the heart. Sometimes a stent is placed in the artery during the angioplasty procedure. A stent is a small mesh tube that, once deployed, supports the inner artery wall and keeps the lumen open. Most people who have heart attacks have narrow or blocked coronary arteries. Thus, cardiac catheterization might be used as an emergency procedure to treat a heart attack. When used with angioplasty, the procedure allows your doctor to open up the blocked coronary arteries and prevent further heart damage. Cardiac catheterization also can help your doctor figure out the best treatment plan for you if you recently recovered from a heart attack but you're having chest pain still. If you had a heart attack that caused major heart damage. If you had an EKG, an electrocardiogram, stress test, or other tests with results that suggest heart disease. Cardiac catheterization also might be used if your doctor thinks you have a heart defect or if you're about to have heart surgery. The procedure shows the overall shape of your heart and the 4 large spaces or heart chambers inside of it. This inside view of the heart will show certain heart defects and help your doctor plan your heart surgery. Sometimes doctors use cardiac catheterization to see how well the heart valves are working. Valves control the blood flow in your heart. They open and shut to allow blood to flow between your heart chambers and into your arteries. Your doctor can also use cardiac catheterization to measure blood flow and oxygen levels in different parts of your heart. He or she can also check how well a man-made heart valve is working and how well your heart is pumping blood. If your doctor thinks you have a heart infection or tumor, he or she may take samples of the heart muscle through the catheter or a biopsy. With the help of cardiac catheterization, doctors can even do minor heart surgery, such as repair of certain heart defects or electrical conduction problems. So what is exactly a cardiac catheterization? Cardiac catheterization is a medical procedure used to diagnose and treat some heart conditions. In this procedure, a long, thin tube called a catheter is put into a blood vessel in your arm, in your groin or upper thigh, even your neck, and threaded all the way to your heart. Through the catheter, your doctor may put a special type of dye in the catheter. The dye will flow through the bloodstream to your heart. Then your doctor will take X-ray pictures of the heart. The dye will make your coronary arteries visible in these pictures. This test is called a coronary angiography. The dye can show whether a waxy substance called a plaque has built up inside of your coronary arteries. Plaque can narrow or block the arteries and restrict the blood flow to your heart. The buildup of plaque in the coronary artery is called coronary heart disease or coronary artery disease. Doctors also can use ultrasound during cardiac catheterization to see blockages in the coronary arteries. Ultrasound uses sound waves to create detailed pictures of the heart's blood vessels. A catheterization is done by cardiologists, specialists in the heart, and usually do it within the confines of the hospital. You're usually awake during the procedure and it causes little or no pain. However, you may feel some soreness in the blood vessels where the catheter was inserted. Let's talk about the risks of the cardiac catheterization. This procedure is very common. It rarely causes serious problems. However, complications can include the following: bleeding, infection, pain at the catheter insertion site, also damage to the blood vessels, and rarely the catheter may scrape or poke a hole in the blood vessel that is threaded to the heart. An allergic reaction to the dye that's used during the coronary angiography is also possible. Other less common complications include arrhythmias or irregular heartbeats, because the heart becomes irritated by this hardware inside of it. These irregular heartbeats often go away on their own after the procedure. However, your doctor may recommend treatment if they persist. Kidney damage caused by the IV dye used during the procedure. Also, blood clots can trigger a stroke, heart attacks, and other serious problems, and this is a common complication of any procedure or surgery. A low blood pressure. a buildup of blood or fluid in the sac that surrounds the heart. This fluid can prevent the heart from beating properly. As with any procedure involving the heart, complications sometimes can be fatal. However, this is a rare complication of cardiac catheterization. The risk of cardiac catheterization is higher in people who are older and in those who have certain diseases or conditions such as chronic kidney disease or diabetes. What to expect after the procedure is done? Well, after your cardiac catheterization, you will be moved to a special area of the hospital that can manage serious cardiac patients like the cardiac rehab unit or cardiac unit. You will rest there for several hours or even overnight. During that time, you'll have to limit your movement to avoid bleeding from the site where the catheter was inserted. While you recover in this area, nurses will check your heart and blood pressure regularly. They will also check for bleeding from the catheter insertion site. A small bruise may form at the catheter insertion site, and the area may feel sore or tender for about 1 week. Let your doctor know if you have problems such as a constant or large amount of bleeding at the insertion site that cannot be stopped with a small bandage. If the pain is unusual, if there's swelling, redness, warmth, fever, or any other signs of infection at or near the site of infection. Talk to your doctor about whether you should avoid certain activities such as heavy lifting for a short time after the procedure. This is the end of the educational video about cardiac catheterization. I hope it was useful to you and that you'll learn a lot. For other videos like this one, go to edxitvideo.com. Thank you.
Okay, so cardiac cath. Congestive heart failure is the second pathological diseases of the heart that we're going to talk about. It's estimated that it affects 6 million Americans and is the leading cause of hospitalizations for those over the age of 65. The causes of congestive heart failure include coronary artery disease, myocardial infarction, cardiomyopathy. If you think back to your med terminology, my meaning muscle, path meaning disease, so disease of the heart muscle, or valve disease. The types of CHF, left-sided heart failure, you have fluid that backs up in the lungs, leading to shortness of breath. Right-sided heart failure, the fluid backs up in the abdomen, legs, and feet. The symptoms that you're going to look for is congestion, fluid retention, and with that fluid retention, the patient may have what's called pitting edema. And that is where you put pressure on the swollen area and the indention stays, and you see how long it takes to return to normal or if it will. Dizziness is another symptom, weakness, a rapid pulse rate, shortness of breath. And this is an example of somebody who has had right-sided failure where the fluid has bumped up into their abdomen. So what you're going to do for this condition is the patient needs to keep their blood pressure regulated. They need to monitor for fluid retention. 3 pounds in 1 day or 5 pounds in a week is too much fluid retention, and they'll need to contact their doctor. They also need to maintain their fluid balance, and they'll oftentimes be asked to keep a documentation of the input and output. Treatment measures may include a thoracentesis or a paracentesis, a puncture of the chest, thoracentesis, puncture of the abdomen, paracentesis. Those are treatment measures, they are not cures. If a patient undergoes a thoracentesis, only a certain amount of fluid can be drawn off, and you're not resolving the underlying pathology, so the fluid just returns. They also will be told to limit their sodium intake, to take all medication as prescribed, and to see their doctor regularly. HOSA has a pathophysiology exam that links very well with this particular topic. If you look at that, it is a written test that consists of 100 questions. You get 90 minutes to do the test. Those 100 questions are multiple choice. There are essay tiebreakers that are included. And it covers both the disease process and the anatomy, so that as you're going through this video, you've covered two disease processes that would be something that you would see on that test. I thank you for your attention today and hope you learned a little bit about the cardiac system.